My name is Wessel van den Berg. I am from Sonke Gender Justice, and I am very thrilled to have this second in a 4-part seminar series on the politics of care. We had a very interesting conversation in December before the break, talking about what it means if we, in the context of an ethic of care, if we care about someone or something and pay attention to that. And now we are going to the second phase, which is this session of men taking care of, or taking the responsibility to take care of someone or something. So we have our friends. I have already introduced you in some manner or form, but let me ask that we do a quick round of introductions. And I think just to say your name and the organization that you represent, and give us a small insight into how your work is related to care and how we think about care. So I suggest we follow the sequence that's on the screen right now, and I will ask you to start, Mbuyiselo.
Well, thank you, Wessel, and good afternoon, colleagues, and those that have joined us. My name is Mbuyiselo Bota. I work for the Commission for Gender Equality. Commission for Gender Equality in South Africa is what we call Chapter 9 institutions. We call them Chapter 9 because they are found in the Chapter 9 of our Constitution. You have the Auditor General, the Commission for Gender Equality, the Public Protector, the CRL, that host of them. There are about 6 or 7 of them, and the aim is to ensure that these organizations, they support our democracy and ensure that this democracy is not threatened in one way or the other. Thank you, Bethel.
Thank you, Mbuyiselo. Gary, over to you.
Yeah, good morning and afternoon to everyone. I'm Gary Barker. I'm the co-founder of Promundo. We work starting in Brazil and now based in the US on engaging men for gender equality. And together with Wessel and other colleagues at Sonke, we started the Men Care campaign together now nearly 10 years ago. But apart from that professional interest, I'm a father. I'm also a son of an elderly father who's dealing with dementia and trying to support my mother and some professional caregivers in that care. And I suppose, lastly, I'm a citizen trying to hold the governments that I'm connected to account to how they provide support for care. I live in Washington, D.C., which is a small colony within the U.S. that actually has no representation within Congress. So my ability to be a citizen and hold my government accountable is somewhat limited. Thrilled to be part of this in this conversation.
Thank you, Gary. Over to you, Asanda.
Hi, my name is Asanda Mwasheng. I come to this as a gender activist. I work with women. I work on gender-based violence and issues around both gender and racial justice based out of South Africa. I'm interested in this conversation because, of course, you know that in South Africa, we have one of the highest rates of fatherlessness. And for me, I always like to have conversations to help people to understand what makes those who do care and those who do ensure their families are two-parent-headed can share. And I also obviously like to have conversations about GBV, about gender issues that are led by men, because I think that's a very important part of the solution to ending patriarchy and everything in between. Thank you.
Thanks so much, Asanda. And my name is Wessel van den Berg again. I work for Sonke Gender Justice. As Gary mentioned, we've worked close to a decade now on the Men Care Global Fatherhood campaign, and supporting program research, program implementation, research advocacy in South Africa and the region on gender equal parenting, non-violent parenting, and the prevention of gender-based violence specifically. So here is an outline of what we are going to go through today. You would have seen from the invitation and the previous session, if you had watched it, that the theoretical context for the conversation that we are hosting today is within a particular framing of an ethic of care that was proposed by an academic called Joan Tronto, Professor Tronto. And she wrote a book in 1993, which is still very much relevant today, called The Moral Boundaries. And we'll talk a little bit about what those moral boundaries are that contain care in modern society. And then, from the MenEngage community, from the MenEngage network, and to be honest, from the MenCare community, we've often come at this work in the context of our focus of engaging men in promoting gender equality or violence prevention. But, we stand on the shoulders of giants. We do this work in the context of decades of work done by mostly women activists, but particularly feminist activists about care work. And a lot of this comes from the work on the various ethics of care that have been suggested. So this is very much a kind of a primer in that, introduction into that. And then we zoom into this particular phase of men taking care of, which is the session that we're focusing on today. The series that we're doing, this is the second one in a series of 4. Each one of them focuses on a particular aspect of an ethic of care. And you will see how that fits in later on in the presentation. And then some of you might have seen the presentation in the symposium, but also published on MenEngage or elsewhere, the review done by Alan Gregg and Michael Flood that speaks about the various programs that have been implemented and basically the approach to engaging men and boys in promoting gender equality. And a key critique, which is not a new critique, by the way, but a key critique that is still around is the fact that this work is often limited to program intervention or the individual level, or at most to community level change, and that we don't necessarily engage sufficiently with the structural and policy implications for change at scale. So we will attempt to do that. We venture into that for each of these sessions, but we will attempt to do that in this session on this topic of an ethic of care and men taking care of. So to get right into the content, I share this definition of care that Tronto and Fisher developed, which is it's worth reading because it's actually quite a comprehensive definition. And it reads as, on the most general level, we suggest that caring be viewed as a species activity that includes everything that we do to maintain, continue, and repair our world so that we can live in it as well as possible. That world includes our bodies, ourselves, and our environment, which we seek to interweave in a complex life-sustaining web. So, there are 2 observations that are pertinent here. The first one is that care is not only concerning people, but we also care for our environment. And we receive services from our environment, which we mostly do not pay for. I mean, the natural environment. And secondly, care is not only a dyadic or a 2-person affair. Care happens at a community level and it happens at a structural level. We often think about care only as the person who is doing the caregiving and the person who is receiving the care. But as we know in the ethic of Ubuntu, after which the symposium is named, such an individualistic perception of human relationship is only one view, and it's quite a modernist, contemporary view on humanity. Whereas a more relational, interconnected, broader perspective, like Ubuntu and like an ethic of care suggests, is actually also as relevant, or perhaps even more relevant. So I would then ask our panelists to just respond to this question. And one of the boundaries that Tronto identified, which many of us are quite familiar with, is the division between the personal and the political. And in fact, the political is deeply personal, both, acting in your own personal capacity when you are in capital or on the square when it's happening, but also acting politically when you are in your house, in your bedroom, in your own domestic space. So within that spirit of the phrase of the personal is political, I'd like to ask our panelists to reflect briefly on something or someone that you are attentive to and that you care about at the moment. And we had planned to only have 1 or 2 respondents per question when we had 6 panelists, but we only have 3 panelists now. So I think this question I would definitely certainly put to all 3 of the panelists. Let me ask that we start with Gary, and then we go to Asanda, and then we go to Mbuyiselo. Thank you.
Thanks, Bessel. Thank you for that introduction. I am always inspired by the your framing of Joan's framing, and thanks for bringing us together around that. I think when you asked the question almost in a singular, but I can't think of it in a singular. I think all of us who are attuned to who we care about, it is that multiple juggling, and I think mine goes from how to help a young adult daughter, find her way in graduate school and living in a new city in a moment where she cannot connect with others. So worried, not about her economic well-being, but really about her, mental health and ability to have the connected life that she deserves. I mentioned before my father who's in fairly advanced stages of dementia, and my mother who's caring for him, and a professional caregiver who's also doing that. And so quite connected around that and watching what COVID has meant, including one of his caregivers getting COVID, and not far away, and weighing on my mother's mental health is an aunt who passed away from COVID in a care facility. So I think, one is my caregiving duties as to those in my immediate family. And I think also care for, the place that I live. And in the past couple of years have been much more connected to local DC politics, where Promundo and then me individually was able to contribute to the debate around extending parental leave, which came online in July in DC. It's nothing compared to what you just mentioned that Sweden has of 9 months, but there are now 8 weeks paid at a reasonable wage replacement. And it resets every year for whether birth or birth of a child, adoption, care for health needs of a close relative, and care for your own health. So, kind of pleased, obviously, lots and lots and lots of amazing groups contributed to that, but thrilled that both in personal connections to some of the city council members involved in that, and then Promundo's use of our MenCare research, feeling like putting some of that care into local politics. So, maybe a small success story of care. So I've been quite attentive to that, how the program works. We now have a staff person who's just come back from taking that leave under the first time the city rolled it out. And so, yeah, perhaps a small one. And then very connected as well to what's happening on COVID and what it means particularly for the Latino and African-American populations and communities in Washington, D.C. My partner works in the frontline health for the Latino community. So I hope she would say that I'm supportive of her in that very important frontline health work. So I guess, yeah, to me, it was a trick question of trying to put it as one. I think all of us are embedded in a web of care that we provide, personal, political, yeah.
Thanks so much, Gary, and congratulations on that fantastic achievement for DC. It sounds amazing. It's a real landmark. Asanda, over to you. What are you, and let me say, who are all the people, or who are some of the people, and what are you attentive to at the moment and caring about?
Well, I'm actually in a very interesting caring situation at the moment, because our our housekeeper has fallen sick, and we having to take care of her. And so for me, this is a very interesting. It's a very interesting dynamic in the sense that it challenges power dynamics, and it also is very interesting because we are all used as a family to her caring for us, and now to be in a position for us to be caring for her. It's quite interesting, and it also, I think, forces one to think about some of the power dynamics, to think about the ways in which we give, but also the ways in which we receive care from people, particularly when it's care that you have paid for, and how, being in this situation where we now have to care for has made us rethink all of that, and has also, brought some interesting dynamics to our own relationship. And then, of course, it being COVID and us being mostly cooped up at home, it's also about learning to care for each other in a different way, in the sense that we have this understanding. I mean, one always knows that we are, as a family, we are one unit, and we all, any part that is not working right has an impact on the other. But I think confinement and COVID and pandemic means that any mental health issues that rise up has an impact on everybody else in the house, and any kind of destabilization to the system really challenges all of us, and requires all of us to think about the ways in which we can care for ourselves and each other differently and better. And I'm quite happy to say that also COVID has been great for me, because while my husband has always been somebody who contributes to housework, etc., it's been interesting to see some of the ways in which he's leading some of the housework, and how we are now, in part because of COVID, getting to a stage where it's become second nature to equally share in a way that I think sometimes under normal circumstances isn't even, it isn't even something that you necessarily think about. Because I don't want to take up too much time, but I think for me, one of the critical things, and obviously feminists emphasize this, it's always about, we can share equally in the housework, but who is leading the thinking, who's doing the mental load? And for me, what's been great about COVID is seeing us share the mental load and the actual work equally. And that has been, I think, revolutionary in my own home. So thank you for asking that question.
Thanks so much, Asanda. And I think, at least in my network of friends and in my own personal experience, this aspect of caring about something, noticing it, paying attention to it, and realizing the care that that might have become invisible, was very much made visible with the strict lockdown that we had for 5 weeks in South Africa, where nobody was allowed to travel. And I think especially for the middle class in South Africa, domestic workers were not allowed to visit the homes that they were working. So on the one hand, that put domestic workers in a very precarious situation, and many of them lost their employment due to that. And then on the other hand, there were lots of middle class voices saying for the first time, oh, that's how the washing machine pipe should fit into the drain, or, oh, okay, why don't we just move the shelf closer to the sink so that we can wash our things closer to the basin, So that kind of middle class unawareness of what it takes to maintain a house was removed. And I think, some of the work that Gary has led on, or Promundo has led on in terms of research on men's participation, it's encouraging to hear from you about you and your partner. As Gary might mention this later, but, what we saw was that men did increase, but so did women, in terms of the contribution to care work. So the kind of the increase was it moved together. And then as we return to a less fraught situation, there's different changes. So it's a complex picture, but thank you so much for your sharing there. Mbuyiselo, over to you. Just reflecting on our conversation last time, and now top of your mind in terms of the people or the things that you are caring about or noticing or paying attention to at the moment.
Well, thank you once again, Vested and colleagues. I began to reflect even more deeper, going back about caring for someone in particular. Many years ago, 1996, my mom suffered a massive stroke, so that meant that she was not able to do anything for herself. Now she had raised 7 of us single-handedly. I've never known my father. I've never met my father. So the only person who I knew as a caregiver at all levels, providing for us our physical needs, ensuring that we went to school, ensuring that emotionally we're well, was the only person, my mom. Now you can imagine that in 1996, here's a tall, strong woman who is unable to do things for herself, who is extremely independent. Suddenly she suffers from this stroke, and I then was married. I'd left home. I was born and bred in Sharkville. She's in Sharkville with my only sister, Buiswa. The sad thing was that Buiswa was not able, or Buiswa just neglected my mom. And I would go home to look at my mother when just to visit her, and I would always, without fail, find her nails in particular uncut. You could also suspect that she has not been birthed for some time, and I would then get into, because she was not able to talk, and you could tell that the frustration, what she was suffering from, because here's a person who for more than 70 years was able to do things on her own for herself, and suddenly she's dependent on other people. And unfortunately, Buiswa was not responsive. My only sister I'm left with, Buiswa, was not responsive. Now I always had to, whenever I arrive home, I would be accompanied by my ex-wife, Nomasonto, but I would always make sure that I bring in the nail cutter. Now I live with disability. Now I had to take her legs, put her on top of her legs, on top of mine, and ensure that I navigate cutting her nails. And it made me to reflect that culturally, I'm a male in the house. I'm supposed not to do what is ordinarily or conventionally supposed to be a woman's work, meaning Buiswa or Nomasonto. But I felt it that, look, I think this is the moment that she needed me most. So it brought back the feelings of deep caring. I then realized, Vessels and colleagues, that the importance of, and it brought us together. We're very close with her, but the fact that should always be expectant whenever I arrived, that I would make sure the one place I would go to was to ensure that her nails were cut, her feet were well washed, well looked after. And I did not even remonstrate with my sister or even ask my wife to do it. So when Vessels and colleagues, when we even the last time when we spoke about care work, I then went back and reflected deeply. And again, this past Monday, when we're planning for this session, that I then began to notice that, in fact, I cared deeply about her well-being. And the one thing, unfortunately, I was unable to do was to put in a path. Again, these cultural constraints. I would always ask Sonti and Buiswa to make sure that she's put in a path and she's bathed or she's washed. But this session, it made me to realize that when you care for someone who cared for you for almost 70 years, how it brings you closer to this individual. So I thought, when Vessel and colleagues, that it, for me, caring for my mother, it made me to again go back, as I shared with you, the initial session, after being cared by someone who's male, was able to ensure that I was properly bathed when I was unable to do so. I think I'll stop there. So if you ask me, I when Vessel and colleagues is the deep reflection and the feeling of closeness and appreciating the role that my mother did, and also her own frustration of not being able to now suddenly care for herself. And unfortunately, she died 7th July 1998. Thank you.
Thank you, Mbuyiselo, for sharing that story. It's really inspiring, and you are already going to our next session, the third one, which is about the caregiving, which is very much about proximity and being close to someone. And I think in the time of social distancing, that proximity of caregiving, not just talking through a screen, but actual, being close enough and safe enough to be able to touch each other is so important. And we briefly reflected on this in the previous conversation, but also there's quite a clear link in attachment theory between the safety that a child develops from that kind of care work that forms a basis for their whole life, for a feeling of confidence, of security, and for forming healthy nonviolent relationships. So thanks very much for sharing that, Mbuyiselo. So colleagues, let me just, I'm going to give now a brief overview of the framework that we are talking around or in. This is the book that I mentioned earlier, written by Professor Tronto, called Moral Boundaries. And, she sketches a picture of the historical development of the barriers to care being valued in society. And the three that she identified were from the top. The first one is that particular lived experience and an abstract moral point of view increasingly became separated over the years. So this, in terms of the kind of ethics theory or the morality theories or moral philosophy, this is the separation between a Kantian or a reason-based philosophy and more of a contextual or practical engaged philosophy of ethics. Secondly, and she observed that these boundaries emerged as markets emerged, as trade between small settlements developed, and people needed to start to trust each other across long distances. So there's a relationship between these boundaries emerging as social distance, actually, and she names it as social distance at the time. These boundaries emerged as social distance increased. So the second one is that political life became removed from morality, and morality, when it was contained in a settlement scale of 300 or 400 people, everybody knew basically what everybody else was doing, and there was a kind of a semi-hierarchical structure in place. But morality and politics were very much the same thing. The right thing to do is what all of us decide together. But as this reason-based thinking emerged, morality became more contained as a kind of a sentimental, emotional type morality, and political life became increasingly cold and reason-based. And then thirdly, the distance between the public space and the private space also increased. So we have these three. And I think, if we reflect on, the last week or the last year, the last few months, these are very explicit in various phenomena that we've seen. And so they are obviously still very relevant. What is quite clear is that this also increasingly, or this is gendered. It was gendered. So the particular lived experience, the sentimentality of morality, and the private experience was very much constructed as a female locus of experience, whereas the abstract, the reasoning, and even thinking about ideas of justice became increasingly constructed as a male space. So the political life, the public life, and now more recently in the context of capitalism, the profit-driven professional life. So we see these two spaces, and it's not really I put this slide together because the previous one might present it as a dichotomy. It's not. It's that the public, the abstract, and the political are centered, or seen as the center of power, whereas the particular lived experience, care as practice, the private experience, and that kind of sentimental flavor, the sugar-coated morality, all of those have been moved to the margins. And Gary has often mentioned this, but it also draws on the work of the care ethicists, the fact that, women are discriminated against by virtue of being associated with care. But the deeper devaluing, the deeper reduction of value is actually in connection to care. Care is what is the key driver of inequality or of devaluing. One example that's quite clear in South Africa, at least, is the payment scales of various teachers. It's really clear from developmental science or childhood development, psychological science and developmental science that the healthy development of the child for the first 3 or 4 or 5 years of their life really sets them on a course for employment, for a future that makes them a contributing, valuable citizen. So if you were to stand back and look at when in the life course the best time to invest in a person's life would be, it is when it is before they turn 7. In fact, in the first 2 years. However, we place a lot more emphasis on the education of young people between the ages of 16 and 24. And we spend much more money on the investment in a person, when they go to college or when they leave secondary school. Whereas the actual value should be in investment is much more strategic if you do it beforehand. And some countries do that. We have some examples of especially the Nordics who invest more in that. So in other words, why should an early childhood development teacher get paid less than a senior school teacher? They should get paid at least the same, if not more, for the early childhood teacher. So anyway, I guess I made my point that these ideas of the public, abstract, and the political life are centered. So to move to an ethic of care and building up to the next panel question, and then I think after that we'll take a brief stretch break. The notion of an ethic of care was it was introduced by quite a few theorists in the 60s, 70s, 80s. The two books, I've mentioned this one by Joan Tronto already, but Carol Gilligan, Professor Gilligan wrote this book called In a Different Voice, which was a seminal introduction. Seminal is a male gendered term. It was a catalytic of impactful book introduced in the late 70s, early 80s, where she critiqued the work of Erik Erikson and Lawrence Kohlberg, who had developed these theories about moral development for humanity. And Gilligan quite astutely observed that their samples were only boys and men. And the psychologists and the researchers were also only men. So it was research by men about men claiming to represent humanity. And she added this book is essentially a count of 3 studies that applied the same research questions or the same direction of research to a more diverse sample. In terms of age, income, and gender. And she then titled it In a Different Voice because she was very much representing the value of voice and the value of women's voices and girls' voices particularly. So it delved into questions like the same that Lawrence Kohlberg put to his sample, where for example, the one question it's titled the Heinz Dilemma. And the question that you put to a respondent is, should a man steal medication to save his wife's life? So should he break into the chemist who is not willing to drop his price to the chemistry or to the pharmacy and steal the medication? And most of the responses from most respondents are obviously or often yes, but the way people respond is often quite different. So the boys that Kohlberg asked this question to responded often in a way that would frame their response as quite a reasoning, calculating response. So, well, we'll have one less person, and we don't want one less person. So, one plus one person is a good thing. Whereas when she asked girls, they responded in more of a relational way, and they said, well, that's really sad, and maybe he should go and talk to the pharmacist again, etc. But she started to see from the girls and the women's responses in all of the studies that there was this ethic of a relational engagement with caring that the voices represented. Tronto pointed out that Gilligan did not say that a care ethic represents women. The fact that women were responding more about care than men were does not mean that that is an inherently female quality. It just reflected the fact that girls and women were actually socialized to respond about that more than the boys and the men were. Gary also mentioned in the previous presentation that from Gilligan's work, she also noticed that boys often expressed the kind of ideal moral goal as being quite project focused or product focused, of having one particular outcome or goal that you strive for, whereas the girls and the women's responses were much more relational in terms of what would be a good thing. So just to pin that with Kohlberg's theory, so that the quite high on Kohlberg's moral development is this idea that if you're able to make a cool, calculated reasoning decision, that is the epitome of morality. Whereas in an ethic of care, if you are able to make a decision that engages with solidarity with others, that is the epitome of morality. For example, to talk about social distancing again, how I feel sitting in Cape Town about people experiencing a severe corona epidemic in Uganda, my feeling of solidarity, if that is quite high, is more moral than me making a calculating decision or not about the well-being of others. So that's a whole presentation on its own. So that's just a brief little glimpse. So let me pass to the panelists, and I'd like to start with Asanda and then pass to Gary. I think this question and the next one, we'll see how time goes, but let's see if we can, if we have enough time, we'll do 3 people per question, but let me start with Asanda and Gary on this one. And to really bring this conversation of an ethic of care, in your work, Asanda, as a gender activist, and your work with Oxfam and others, in the context of what we've seen in 2020, where have you seen this ethic of care being challenged? And then secondly, where is there hope? Where is there promise? Where have we seen it emerge into practice? So that kind of double-barreled question. I added a third layer to the double-barreled question. So my vegan taco has 3 layers. It's being challenged, it's emerging into practice, and then, if we can speak particularly about the gendered ways that this is expressed. So over to you, Asanda.
Okay, thank you. So for me, I think, just taking obviously both work that I've done with Oxfam and other organizations, and also just work that I do in general, what's been interesting to see particularly is the ways in which civil society has come together because of COVID. So that Coalition 19 effort, and some of the very interesting ways that organizations that normally compete, if you can call it that, were able to come together and actually create things together, and also like become an information sharing platform for each other. That was a very interesting practice of care that I noticed and I recognized. And I think also for me, what was interesting again is to see men sometimes taking the lead in putting together soup kitchen efforts, seeing men taking the lead in making sure that children are taken care of because the wife is the only one who's able to work for whatever reason, or because there's only one income that's coming into the household, or they've lost their job and suddenly they have all this time which they didn't have before. And that's been a very interesting dynamic to notice and to think about as well, because it really also raised the question, I think, for me in some ways around, this issue that we discussed at some stage around how care is care, and particularly fatherhood care, is actually quite a classed thing. And so essentially part of what we need to do is challenge and think through how could working class men be more caring, or how much more care would they contribute if they didn't have the need to provide, if they didn't have the economic pressures that they do have, and if they didn't have the kind of jobs that require a specific kind of presence at work, etc., etc. And so that's been very interesting for me to observe. And of course, as I said earlier, just not just in my own relationship, but in observing people's different relationships and how people have been able to see men take a little bit more care, and men participate, particularly in the mental work of thinking about what the next meal is going to be, in the mental work of thinking about when the laundry is going to be washed, in the mental work of just trying to figure out how we're going to survive the day. And that has been very interesting. While of course we know that inequality doesn't just disappear because you have COVID. And so yes, women are doing more fetching water because people need more water to wash their hands. And yes, women are doing a lot more caring work because people who are sick during this period are having to be cared for more by women. And I think that, we talk quite a lot about people who are sick due to COVID, but there's also a lot of people who are sick and it's not COVID, and who now don't have spaces and places that they can go to, who families now need to take care of. If you think about people who were previously in institutions for mental health, previously in institutions for all kinds of disabilities, now families have had to take care of those people because those hospitals are overrun, and also there's the fear that you can't keep too many people together. And so it's been interesting for me to observe how families respond to that, and who is responding to that, and what the power dynamics and the gender dynamics are. So I think there's hope. In a lot of ways, we're seeing a lot of challenging around that, but I think also, the usual inequality keeps showing itself up. But I want to emphasize that for me, it's been amazing to just see the amount of hope and the amount of, I think, just in general, people rethinking what their role could be. And I think what's also been particularly interesting is noticing how almost the absence of money, so people no longer being able to contribute financially, has forced people to rethink, how else can I contribute to my family? How else can I take care of my children? How else can I take care of my family? And so those are some of the thoughts that are emerging, and some of the things that I've been noticing that I wanted to share. Thank you.
Thanks, Asanda. And I've been listening quite carefully to how you speak about, and your use of the phrase "taking care of." So, how else can I take care of my family? And that's very much the content that we're going to go into in the next session. Is this notion of taking care of means taking responsibility for. And it's often expressed financially, and we'll talk about that later today. But it might not be expressed financially. It might be, how do I take care of in ways that are not necessarily financial. Gary, your reflection on where you've seen this an ethic of care being challenged and emerge into practice.
Yeah, I mean, picking up on Asanda's points, I think how do we make care visible? And I think this, COVID has been first and foremost a crisis of care, whether it's at home or the political crises that we're seeing in governments, whether leaders in national governments and local governments put the care of people first, or if they put the care of their own power or their own privilege or profits, if they're focused on the bottom line of economies. I mean, I think, this has made us become aware of just how much, as you set out the definition before, Vessel, of how much our lives are care, the care we receive from the world and from those around us, and the care that we provide. I think both from the daily practices of, myself or other, male family members or friends who have seen things that we thought we delegated, or, that caregiver who's providing care for my father over here, if she gets sick, how do we have to step in? And then supporting my mother, kind of so used to it being a series of women who do that work, and how the crisis of COVID in so many levels is making us attuned to this, I think is key. And I think, as we look at the political level, to watch, my two home countries of Brazil and US have had horrible, careless leaders who have both scoffed the public health things that we need to do to care for the other. What I do to wear a mask and keep social distancing is to protect the other, and how that's turned into a political battle of whether you tell me what to do. And I am somewhat encouraged that, both the results of the US elections and what it looks like things are heading in Brazil with, family members who thought Bolsonaro was a good idea now saying, oh, maybe not, that I think the effects of these careless policies are becoming somewhat obvious. It's going to be a huge fight. And as we saw in the US last week, and it's not over. But, there's still the politics of angry white male entitlement are very much alive and well. That careless, you don't tell me what to do, I'm do this. I think that privilege is being questioned. And so I'm somewhat encouraged by that political level. And then, third, I think and you highlighted before, Vessel, the research that some of the research that we've carried out together with Oxfam as well, looking at women's and men's caregiving during COVID. UN Women also did a number of studies, finding quite consistently that men are doing more, but women are doing still even more, because we started off with this huge inequality of women doing 3 times as much. COVID's meant women are doing more, men are doing more, but there's still this huge gap between the amount that men are doing. The positive thing there is that men are doing more, and I think we need to figure out how to sustain that post-COVID, how to make that part of the practices of individual men's lives and the workplaces and the world around us that shape how we act. I'm slightly encouraged by that, by results of a study we're going to come out with in a couple of weeks that Nikki van de Gogh, who's also among the participants, is part of a study that we did of 40 corporations in the US and the UK on their parental leave policies during COVID. 72% of those, or 3/4 of them, if I'll give a preview of that result, said that they survived the effects of COVID better as a workplace because of having good parental leave policies, including men in them and nudging men to take them as well. I don't certainly look at the corporate sector as our leader on how to be a more just world, but I think it is encouraging, and perhaps in a few right-wing places like the US, Brazil, and some others, that corporations are seeing the obvious need that human beings have for care, and that we can't separate that from our daily working lives. I think Asanda was hinting that as well. How to break the barriers between those, I think, is where I'm slightly optimistic that the world is making men do more of this. And I hope that we'll continue to hold men accountable, and to hold those who make decisions about workplaces and policies accountable, to say we don't separate our productive and reproductive lives. They're together, they're connected. And I think your point of Vessel before, of how we've separated kind of the caring morality as soft, feminine, not important for the world, and then the rational, production side of morality. I think COVID kind of breaks that barrier down, and I hope it continues.
Thanks, Gary.
I hope COVID continues. I want to say that. I hope that breaking down of the barrier continues.
Yeah. Do you want to say a little bit more about that last comment? You're kind of leaving us there with the cliffhanger.
I think that, there's nothing like men being forced to, the world obligating men, the world around men obligating us to be responsible for the mental load, for the hands-on load, that I think makes it real, rather than us with all the, the data that we've put out from years of the State of the World's Fathers reports and others making the case of the inequality. I think it is in those lived experiences and the world around men saying, you can't walk away from this care, you have to do it. I think I hope breaks that barrier that you highlighted really thoughtfully with the slide of you can't separate a political macro morality, a rational based morality, from what you must do in your life as an ethic of care. So I hope we can continue to sustain that.
Agreed. Yeah, and I think we have enough time to go to Mbuyiselo. I just before Mbuyiselo, before I go to you, I'd like you to also respond to this question. But just to say from my some of my qualitative work that I've done for my doctorate that underpins much of this presentation. I heard from quite a few fathers who took on, exactly like you were saying, Asanda, who took on more childcare work and the practical work of domestic work. And what became apparent to me is that once you do that practically, you can't unsee it. It's once you actually have done that work, you know what it takes to do that work. At least in the short term, it might be invisible to you until you have to do it. Our friend Vidar often makes the point that he advocates for, and our colleagues from the Netherlands have also increasingly advocated for solo care. In other words, that a father takes care of the family without the mother for a minimum of a week or two. So that you actually you can't just survive on takeaways and Netflix for 2 days or 3 days, but you actually need to start doing laundry and doing the care work that sustains the house regularly. And what was apparent from the interviews that I did was that the men who had done that said, well, now I know, what it takes to do 3 loads of laundry a day, and I can't ignore that. Our domestic worker has returned and she keeps on doing that, but I now have a visceral experience of doing that myself. So as Tronto calls it, the epistemological ignorance has been erased. So absolutely, I agree, Gary. So Mbuyiselo, just in the context of 2020, where you saw an ethic of care being challenged and where you saw some signs of hope and where that was gendered, and then on the hour or just past the hour, we'll take a few minutes of a stretch break. Over to you, Mbuyiselo.
Thank you, Wessel. One of the challenges that emerged for me 2020 was how our healthcare system, the entire health system, from your local clinics, your major hospitals, how they were. COVID has in fact exposed how inadequate these care facilities has been. But more for me importantly was that how a woman would give birth in the street in Mamelodi, because there's this attitude that how do you fall pregnant when you're 43? That for me is in fact an antithesis of what Ubuntu is all about. I sat and looked at a woman being chained, in hospital, because she suffered from mental health. You then ask yourself, here is an individual who part of her being, her profession calls on, other than Ubuntu, is her professional life should in fact be an embodiment of care. But here is, without even hesitation, chains a 73-year-old woman, to a chair, because according to her, there was something wrong with her. Now you ask yourself, where is care? Where is care? But also, where's Ubuntu? You are because I am because you are. But you also, yesterday, Wessel colleagues, you had a woman who was found wandering naked. Instead of thinking about her as suffering from mental health, be it depression or what, in fact, she was stoned to death and burned. Now you don't find this happening to men. So these are examples that, in fact, if you ask me, I don't I don't even see a ray of hope, especially as it comes to, and maybe that goes to the next session of this our work on how the entire health system in South Africa was exposed. And I remember that a while back, when this whole thing, when COVID in March, I wrote a piece in my Sowetan column, which said that, look, the beauty about COVID is that all of us were the same in the sense that no political leader would jet out to France for a superior medical care. I mean, as they often do, because they are privileged, because they have money. So what COVID did was that it in fact put into sharp focus how all of us, we're in the same position. Even as we speak now, our private healthcare facilities are not able to cope with the number of COVID presentations in the various most expensive high-yield health services. So for me, again, at the core is that it is women who carry the disproportionate burden of these challenges. Thank you so much.
Thanks, Mbuyiselo. As you were talking about the state of hospitals, I was reminded of something that is a bit that is hopeful, which I think I'll leave us with before we go on the break. A part of our lockdown regulations includes the prohibition of alcohol sales and distribution. And, prohibition is not, obviously, as we've seen from historical examples, prohibition is not a long-term solution. But in the short term, the strategy is to prevent alcohol sales, to enable more space in hospitals to be available because of less trauma cases. So creating space in hospitals for COVID patients by reducing the number of beds that are required for trauma cases. And the one hospital, there was a news item, and Mbuyiselo and Asanda would know about this, at Baragwanath Hospital. I think it was over Christmas or over New Year's when they usually swamped with alcohol-related trauma cases. For the first time since the establishment of the hospital, and the hospital is decades old. I think it's 40 or 50 or 60 years old actually. But for the first time in the hospital's history, they had an empty ward on that evening when they usually are swamped. So I think there's a sign of hope there that we have to learn something about alcohol. We know about that, but it was very clear that the physical trauma suffered due to alcohol has been radically reduced, at least for those cases that end up in hospital. So that's from me, that's quite a naive interpretation of the news, and I think Asanda and Mbuyiselo might know a bit more of a complex analysis of that, but that was encouraging to me. And I think one manifestation of an ethic of care would be thinking about how one manages alcohol in society. So let's take a break. It's now on my clock, it's 4 minutes past the hour. Go and have a drink of water and a stretch break, and please come back. For those who are on the call, I appreciate Moses and Nilar and Nikki, the conversation going in the chat box. It's great to see that. We will have some time for a discussion from all participants. We're quite a relatively small group. We're about 20 people on the call, but it would be nice to hear all of your voices when we close at the end as well. So let's take a break, and then I'll start. It's now 5 minutes past the hour. I'll start speaking again at 9 minutes past the hour, and then the presentation will start again at 10 minutes past the hour. So have a good break, everyone, and please don't leave. Please stay logged in, and we'll see you soon. Okay, welcome back, everybody. I hope that you had a good break. I can see that I'm already into my presentation. There we go. There's the where the presentation is starting. Not sure if Mbuyiselo and Gary are back yet, but I think I can already start. and then we'll go into the second section. So the phase of care, the care phase that we're talking about, and I'll speak about this image that is on the page in a moment. But the care phase that we are talking about at the moment is called taking care of. And I'd like to put that in context of the other 3 phases or 4, so the total 4 phases of care that Tronto proposed. Other care ethicists like Nell Noddings and actually Carol Gilligan also proposed various iterations of the same model of, the whole spectrum of care. Some go up to about 8 phases of care or 8 different aspects of care that one needs to think about. But for Tronto, she summarized it into these 4 that started from caring about on the right-hand side, which is the feeling and the attention that one pays to the need of care. And that you notice something, that you have an epistemological, you have a world awareness of the care that is required. That is a precursor to the one we're talking about today, which is taking care of, which is the actual taking of responsibility to provide resources to care for the one in need of care, or the item in need of care. And then giving care is the one that's, we are very familiar with in terms of time use studies, etc., in terms of the very practical, proximal work of doing care work. And then the 4th one, which is a really interesting one in terms of the lens that I'm applying, which is men's engagement with this ethic of receiving care. So where the care need is resolved and the person is responsive to the care need given. In the context of the moral theory that underpins this, Tronto identified 4 moral elements to these 4 phases. So the moral imperative, or the morality that is expressed for caring about in being able to pay attention to something, in taking care of, to actually take the responsibility, and for giving care to be competent in the care that you are giving. And when you are receiving care, to actually respond to the receiving of the care, which is interesting too, that there's a moral imperative to receiving care. Mwisela mentioned the South African health system and how we struggled with responding to the volume of corona cases that we are dealing with at the moment. There's a very sad case, a tragic case that most South Africans are aware of, called the Life Esedimeni tragedy, where a group of patients in need of mental health support were essentially placed in the care of unqualified facilities, non-governmental facilities. So the Department of Health had essentially farmed out or outsourced their responsibility, and it's a really good example of how the phase of taking care of and the competence in giving care are connected. So that when you according to them, they had taken care of it because they had assigned the task to someone else, but their responsibility was lacking because they did not ensure competence. So that's one example of how this model can be put into practice when one assesses how care is put into practice. And then the political point, which I think is really a key contribution that Tronto makes, is that those who receive care and those who give care usually have less societal power than those who are in the position where they can care about something, or they or they are taking care of something. And this to me was a really interesting insight. I think in the climate and environment conversation also, there was a ironic situation where I once saw a presentation being done to a group of people living in a township just outside of Cape Town, where the presenter was exhorting them to go to the most expensive supermarket that we have, Woolworths, to buy organic chickens because that's the right thing to do. And it was so ironic because the people sitting in the room, most of them had their own chickens in their own backyard. And in fact, when you look at the ecological footprint of the township or the informal settlement where they were living, the ecological footprint of their dwellings were much lower than the middle class production of organic chickens that they were being asked to buy. The relevance there is that the least relative social power that one enjoys is often you are only in a situation of thinking about how can I take care of myself on my own today and tomorrow. Is there going to be a meal on the table today? And I don't necessarily have the luxury to care about the climate. I just want to make sure there's a food on my table today. So anyway, it's an interesting framework to think about. The one we're focusing on today is this one of taking care of, and particularly men taking care of and taking responsibility of. It matches some of the more psychological research on fatherhood that has been done by Michael Lamb and his colleague Joseph Pleck in the recent iteration that they did of the typology, which Lamb presented in the 80s on fatherhood, which is basically 5 elements of the ideal or the psychological model of father involvement. And Lamb and other colleagues, as have we at MenCare, we've often made the case that it's so important to think about involvement in a more complex way than only the financial way. At the same time, this locates it where in addition to the more direct father involvement dimensions of positive engagement, of warmth and responsiveness, and then of control, which is basically monitoring and supporting the decisions that you make about your child. There are 2 that fall in the domain of responsibility or father responsibility. And this is where it matches the ethic that Tronto had put together. So the bottom 2 points, indirect care and process responsibility. I'm not going to go through all of that in detail, but it just basically means that you are responsible for the care of another. The description that Pleck gave in the Father and Child Development, the book, the recent publication in 2010, was that indirect care is the role that a father takes in making sure that the child is taken care of and arranging for resources to be available for the child. So it's not only paying school fees, it's also arranging for babysitters, making appointments with pediatricians, seeing that the child is taken to them, and being in touch, like Asanda was saying, the mental load of determining when the child needs new clothes, etc. So, I'd like to ask the panel, and I think I'll start with you, Asanda. Just my question is framed. It might appear quite negatively, but I was struggling to frame this in a positive way, where we're interested in that edge of not paying attention to the care that's required, and then starting to pay attention to the care that's required. So, when I say somebody has not previously cared about something, I'm not saying that they were necessarily antagonistic towards it. I'm just saying that they didn't notice it. So if you have an example where somebody started to notice the care they started to care about something, and then they actually started to take some responsibility for that. The example you mentioned already does answer that question, but if there's anything else, any other examples that come up for you, please.
Yeah, thanks for that question. I think an example that comes to mind is one of the projects that we did with Oxfam down in the Eastern Cape, where young people started participating in communal food gardens. And through that program, we began to see young people who were previously drug addicts become, contributing members of society and really finding a purpose in serving the community. And what's interesting is just hearing some of the engagements and some of the thinking and how their thinking has changed, because they now understand that they have a responsibility to the community, and that, again, this thing of masculinity telling people that the only contribution they can have is financial. These are young people who were unemployed and they didn't feel they had any prospects, and that's how, in part, they ended up with drugs. But by participating in a community activity of growing your food, they were able to see themselves as positive influences and as people who have the power, the agency, and the capacity to contribute to society. And I think we often underestimate the ways in which men, and in particular young men, are not necessarily always educated on the important contributions that they can make beyond their financial, but also that they also have a responsibility to care for the community, that they also have a responsibility to be positive influences in the community and contribute positively in the community. I think there's an expectation of women to take on those roles. There's an expectation of women to care about, at an individual and a communal level, but we're not placing the same amount of responsibility, and we're not having the same amount of expectation of young men. And so it was quite interesting for me to see that, and just to hear, as I said, the stories of what changes for them when they become a part of community. And I think that's something in general that it's something I'm quite passionate about the ways in which people suddenly find an ethic of care when they are able to care for themselves, because part of what they were able to get through the food programs was food for themselves, of course. And so sometimes by showing people how you can care for yourself and also contribute to the community, they begin to see the importance of communal caring, because that, for me, that's one of the really missing things in a lot of communities that are faced with tough socioeconomic challenges. That's one of the first things to go, this ability to care for others, because you have nothing to share, and one doesn't always understand or think about the many things that they can share beyond the financial, because we live in a materialistic world that emphasizes the financial, and a patriarchal world that emphasizes the importance of a man providing. People aren't always given the opportunity, or don't always think about themselves as people who have the potential to care and to contribute outside of the financial and the material.
Thanks, Asanda. That's really inspiring. So it sounded like they took on responsibility for the care of the gardens, the communal. They became contributing, and I heard you say that they were educated about that. Could you maybe just repeat or maybe unpack a little bit what it was that changed their perspective? Because it sounded like they were dependent on drug use at a point, but what had changed?
So I mean, what the program did is that it looked for people within the community who didn't have current economic and other activity, who wanted to participate. And so some of them were even forced by their parents to participate in something to keep them busy. Some participated voluntarily, but at the time that they were participating, they were still they're still taking part in some of the drug use. But as time went, and as they saw, as they saw themselves becoming respected members of society, and they saw the change in the community response, and I think also as they saw themselves, because I think there's something about growing something. So there's this idea of creating something and helping something to live, in the same way that for a lot of men, sometimes fatherhood changes them completely in ways that were not possible before. Something as basic as growing plants also can have the same sort of effect. So I think that was the thing, that this understanding, or this realization over time, that by contributing to feeding themselves, and therefore contributing to a communal garden, they are then able to become a different person in society, and they get appreciated differently by society. Society responds to them differently. And I think even before society, their own parents and their own relatives, because you can imagine, a parent of a drug user would have attempted and tried many, many things before they get to actually, seeing the change or the difference. And so that positive response, that encouragement, that belief. I think just the belief that people in the project believe that they could, and that they had it in them to be positive contributors. Those are some of the things that I think make a big difference. And for me, this is part of the very important work that needs to be done, or needs to continue being done with young men in particular, that they understand that they have the potential, even without a penny, to be positive contributors to society, that they have the potential to contribute in ways beyond the financial, in ways beyond the usual sort of cookie cutter provider role. And so that I really I enjoyed engaging with some of the stories of those people.
Thank you so much, Asanda. I'm reminded of the it's often quite cliched, but the 12-step addiction recovery program, where there's before you start a human relationship, see if you can care for a pot plant. And then once you can care for a plant, you might upgrade to a pet, and if the pet's alive after six months or a year, maybe you can upgrade to nurturing a life partner relationship, for example. But it sounds really encouraging. That's really great work. And I also hear what you're saying, that they are taking care of something, and it's without having the financial means to contribute financially. They're actually contributing resources that go beyond the financial. Gary, let me pass to you for a response on this one as well.
Yeah, as I was listening to Asanda's example, I remembered back to the study that we did that kind of helped frame the creation of the Men Care campaign, which was the Men Who Care study. And we did interviews with I think it was about 85 men, Brazil, India, Mexico, Chile, South Africa, and kind of looking at this gender divide of care work. No country's achieved equality on it. We said, yeah, but there's lots of men who do it. What seems to drive men to break out of this idea that care work is women's work? Where do we see examples? Let's listen to life histories of men who have done this more. And whether it was rural India or urban Brazil or Cape Town, the stories were pretty similar, that it was something external shook men up to have to do this. A spouse who had a special need, an illness, or incapacitated, or passed away. It was he lost his job or income, and she had income in the case of a heterosexual household. In the case of men who are doing care work as a profession, it was typically somebody else in their family setting who nudged them toward, hey, why don't you, apply for work as a daycare worker? I interviewed one of those in Brazil, who was one of 3 men who were among about 5,000 early childcare workers who worked for the city in the city provided childcare services in Rio de Janeiro, and asking him, hey, how did this happen? And how is that going for you? And he basically said, well, a cousin, female, had seen that there was a job opening for childcare workers, and I was also applying for a security job instead. And I thought, much more interesting to care for young children than to carry a gun and guard a building. But I kind of thought, wait, can men do this? And his cousin said, yeah, why not? And so he applied and got the job, and talked about his own journey through, it wasn't like he woke up one morning saying, I'm going to do my share of the care. It was something that nudged him around him, that said, and the importance particularly of the woman who directed the daycare center where he worked, who said men can do this. And then his journey to saying, and I can do this at home if I can do this as a profession. So I think it's thinking about that. And our work, Vessel, I think you might, agree that much of our work around the training activities that we do, the Program P manual that's been used in South Africa and Rwanda and parts of Latin America and elsewhere, Lebanon, et cetera, one of the key activities is getting men to go home and doing some care activity they've never done before. And that's probably the most, impactful activity, particularly when they see other men doing it, to change this notion of which activities are gendered, are seen as women's work, and that I'll lose face, or people will laugh at me, or my mates will laugh at me if I do this. And I think that's the shift that we're about to break the gender idea that certain care functions are feminine, to make men more aware of them, but to not assume it's just individual men who can, that by just saying, hey, men, you're not doing your share of the mental load, you're not doing your share. It is, what do we do to change the world around men that nudges them towards seeing this care of another? But I think as we look, and COVID's been a great shift around for all that it's meant as a global economic and social and political crisis. I think it is pushing some men more into the care. The issue is when, as when World War II ended and, women worked in the factories in Europe and North America because we needed them. And then the 1950s came and we said, go back, men do that factory work and women stay at home. The question, I think, historically post-COVID, will we look at this as a moment that we took advantage and really shifted and pushed a care revolution? Or a couple of years from now, will the new normal be, that again, we consider this women's work? So yeah, I think I gave more kind of macro examples, but I think there's hundreds and thousands and millions of examples where we can see that, kind of what does it take to push men into that new care role? It's happening in a huge scale today. Will it continue?
Yeah, thanks, Gary. Mbuyiselo, I'm going to come to you in a moment, but I want to move us a little bit ahead. I want to just, because it is so important and it is so contentious, I did attach some of the presentation time to thinking about the provider role. And, from MenCare at least, and from, work by Professor Robert Morell and others, we should not, or I try not to go into a narrative where it's either sweat equity or either direct care work or finance, but ideally that you should take responsibility, or I should take responsibility financially where I can, and do the other work also. So it's more of an expansion than a replacement. This is one of the men in the interviews that I had did for my doctorate, where the man is quite a acclaimed artist. He's well regarded across the country, and his name is quite familiar. My respondents are confidential, so I can't mention his name. But he had a shift in his life where he went from living quite a carefree life on his own in a cottage in the mountain and just producing great art, to actually moving into a family and having children. And he shared this anecdote where he said that, like a few other things that clients or people don't need to know about, it pays the bills. They want a certain thing and it has to look like this, and they bring you a photo because they've seen it and it has to look like this. But it's not you at all anymore. And then you set a price to do it and they agree. And all that you think about is this will pay the school fees and also the rent. He had shared an example where he had to produce a copper tree with silver squirrels. And it was completely compromising his artistic ethic. He was like, this is, if he were to have his own creative time, this is not something that he would come close to. And he wasn't even willing to sign the sculpture. But he compromised this artistic ethic that he had because he felt responsible to take care of his children. It's a very middle-class example, but I think it does demonstrate the point that priorities change and that responsibility becomes, you sacrifice things that might be quite important to you in order to take on a new type of responsibility when you take care of the one that is in need of care. Then the second story is this man whose name is Knowledge. And Mbuyiselo, I want to ask you just to, I'll tell the story, but just before I do, I just want to ask you to explain the term ATM father, what that means.
Well, thanks, Vessel, again. ATM father, it is a term that I humbly coined because it meant, and Asanda alluded to it, that, look, we have been socialized to think that our relationship with our children as fathers, it just starts and stops with us providing materially, that I will give you 50 rand, and I will make sure that you have money. I'll make sure that you have food. As to the emotional part of it, the majority of us has been taught that it's okay to be detached. So in fact, that's how I in fact coined this ATM father, where a lot of boys would say Kasi, that hey, timer laka, my timer is okay, my timer provides. But when you go deeper and ask, how does your father provide? Does your father know what you do with the money? Things of, is your father involved in your relationships? If you have a relationship, and none of those, do happen. So for it's only limited to that. He always makes sure that I am well off. I have money to spend. As to what I spend it with what and how, men are not involved. So that's the concept when a person.
Thanks, Boiselo. This exactly, and thank you for explaining that. The picture is of a man called Knowledge. His name is Knowledge, and he benefited from a ruling that gave him access to his children, regardless of the fact that he had not paid the bride price, which is traditionally negotiated in South Africa, called lobola. Bride price is not an accurate translation of lobola, but it's one of the better ones. The report that this is the cover of was a study of absent fathers, young absent unemployed fathers, who expressed this frustration that they felt they can't act as a father in any way because they don't have money. So that was very much the limitation of the financial provider stereotype that they experienced. So the more structural dimension, and I think the more contentious topic to dive into, is who takes care of children, and then how do we bridge the divide between the two narratives that often dominate debates in media, in law, and in research. On the one hand, we have this statistics from our general household surveys, which show the fact that most children live with a primary caregiver who is a woman, mostly a mother or a grandmother. And when we, on this slide, the word father is relating to a biological father. So most children live with mothers and grandmothers. It's important, however, to note that this is co-residence. This is not a measure of care or involvement. It is, from what we know, it is likely that somebody who lives with somebody is being cared for. So a child living with their mother is likely being cared for by the mother. And time use studies do confirm that it's mostly mothers who care for children. But what's really interesting was, if you look at a broader analysis, 71% of children live with an adult man. So those, how to interpret that is that 36% of children live with their biological father. We showed that on the previous slide. So that's the 69% of the others who do not live with their biological father. But, there's that interesting 35% in the middle where there are a significant amount of children who live with a man who is not their biological father. And, we were saying on the preparation session that, we sometimes speak as if we live on this planet where children aren't exposed to men, or where men are not included in children's extended families. And in fact, most children have a man in their household. The problem is, of course, as we know, and in the context of this conversation, that men don't contribute enough to the care of the children. So to sketch this divide, on the one hand, we have the situation where children are mostly cared for by mothers. And if you talk about the contentious topic of maintenance or child alimony, mothers are often frustrated about the fact that the fathers who are non-resident and are not paying the required maintenance. And the legal system is often also not very supportive of that process. On the other hand, we have the very strong voice from fathers' rights advocates like Fathers for Justice, who say that family law is destroying lives and that there is an inherent bias against fathers in the law system. So we've got these two voices. On the one hand, we know that children mostly live with mothers, but then on the other hand, we hear fathers' rights groups saying that we are being denied access to our children. What we noticed was that the fathers' rights groups in South Africa, at least, are mostly middle class, and it's actually, if you look at that demographic in that quintile, that upper income quintile, the richest 20% of the country, that's where the highest co-residence is. So that's actually where children most live with their fathers. The most children who do not live with their biological fathers are actually in the lowest income quintile. So it's mostly women who care in the poorest households. So there's, you start to see the cracks appear in the argument that, children are being kept away from their fathers by mothers who want to deny fathers access. So we've got about 18 minutes left, and I do want to hear a little bit from the friends who are in the participant group as well. But let me ask each of our speakers to just give your thoughts on this topic of systemically, how can we think about this divide of it's actually mostly mothers who care for children, but fathers are frustrated because they want access to children. I've given some prompts here. You don't have to respond to those prompts, but anything that you have that from your experience and research that could help. So let me start with Asanda, and then I'll go to Gary, and I'll start with Asanda, then Mbuyiselo, then Gary. So Asanda.
I think that the question is interesting for me, but I think that it's a walking and chewing gum at the same time situation, where we need to address the fact that the majority of care work is done by mothers for children, and biological fathers are in the main absent. Because I think, I like how your graph actually shows that it's 36% are biological fathers. And so, yes, children do have access to other adult males, and yes, children do have access to whether it's the father or the uncle, whoever it is, but it's still the question of where the fathers are still remains. It's still 36% of biological fathers are absent, because there's a different relationship between biological children and biological fathers and stepfathers and uncles, etc., etc. And while a lot of men can sort of replace and play that role, studies have shown that there is a very specific role that a biological father can play that very few people can sort of replace. And so I think, while I'm glad to hear that children have access to fatherhood, to father figures and male role models, it's still important for us to emphasize the biological. I mean, obviously, we're not talking about cases of adoption, but we're talking in particular where there is potential or the child should be living with their biological parents. And then I think that at the same time, we do need to talk about what are the ways in which some women do abuse the systems that are in place, and how do we create systems that allow the men who do need to access their children to access their children. But that doesn't mean that the laws have to change and they now need to be pro men, because we're still living in a patriarchal society, and intersectionality tells us that there will be outlying cases where men are being denied. And as I said in our argument, to me, sometimes it feels like the argument about when women are talking about the ways in which men rape and commit gender-based violence against women, some men do then say, what about the women who falsely accuse, or what about the men who are raped? So all those conversations can take place at the same time, but we can't deny that for the overwhelming majority of women, they are overburdened in the sense that they are having to take care of two children when they created children with presumably somebody. And I think also it's important to obviously talk about the difference between the individual and the institutional, and particularly in a country like South Africa, where we have a history of apartheid, and apartheid had forced the introduction of the hut tax actually caused the breakdown of the family structure, because it forced men to go and work in the mines and to go and work very far from their families, thereby creating a culture which actually doesn't originally exist, where men live far from their children, sometimes not seeing their children for up to a full year. And if you look at, if you look at the issues like Marikana and the fight that was for mine workers, and you connect it to what it is that men actually have to give up by going and working in the mines, and what it is that the families of those men had to give up, it makes sense that they would prioritize that. At the very least, allow me to be the provider that I should be if I'm not going to see my family for a year. So I think it's very important to think in terms of intersectionality and to recognize that the structure, isn't, I'll leave it at that. Sorry.
Thanks so much, Asanda. And I'm sorry I'm rushing you a little bit there. I wanted to just give an opportunity to Mbuyiselo to go next and give us a sense of this bridging the divide between the father's rights voices and the women who are actually taking care of children.
Vessel, thank you once again. I think I want to go back to give a personal experience. I am being taught an amazing lesson by my nephew. My sister's child, Mandla. Mandla was born 1994, 26 August. Mandla does not know his father or has no relationship with his father. Buiswa, my younger sister, does not live with Mandla, lives with a boyfriend. But here's the interesting part. Mandla is raising Mbuyiselo, who is named after me, born 2009. Now, what is interesting is that both of them are of different fathers, that both don't know their fathers or they don't have a relationship. But Vessel, why am I raising this is that I'm being taught a lifelong lesson by Mandla, who literally is raising Mbuyiselo. I mean, if you ask Buiswa, she has no role, and I wanted to talk about it in the other segment about someone who does not care, but then who continues not to care. But in this instance here's a young man who is born 1994, 26 August, who's 26 years old, who is a final year honor student in social work at the University of Northwest, who you'd expect that there are other pressing things that young people do. But his focus is to raise his brother. What does that mean is that, if you ask, the examples of good practice, here's a young man who I hope that his peers in Sharkville are able to emulate, to learn. And what am I saying? I'm saying that, colleagues, we would have to go back and, to have these examples of men doing practical care work as good practices, that they become a good example that we can encourage other young people, especially young men, to replicate in our communities, in our society. So I think that for me, what needs to change is, how we, in fact, how we're raised as boys, but also, how, the early childhood, Vessel, that, this is where we need to start as to how do we make sure that even in those spaces, young kids are able to know that it is possible for a father to, in fact, take his child to crèche, to bath him or her, and to take care of their needs. These changes, they don't only have to be at a legislative level. At community level, we would have to in fact do a lot of work in that area. And I remember that whilst working at Sonke, when a Vessel, we had these interventions. We would go to the rural of the rural in Natal and then do the work that Gary referenced to. You in those interactions, you would see young people who would say, you know what, my father cares for me, but I'm now also caring for my younger siblings, my sister or my brother. So I'm just saying that communities would have to see these examples of good practice as that they become a norm. Thank you, Vessel.
Thanks, Mbuyiselo. Gary.
Yeah, just very quickly, I think, we've got to get beyond the demonization of low-income men. I think our language around even that word absent father kind of presumes that if he's not living in the household, he has no connection. I think using words like non-residential or non-custodial, the US for a long time used the expression deadbeat dads. And in Portuguese and Brazil, there's similar words for vagabundo, malandro. They're moralistic terms that he failed morally by not being present. Instead of saying he is a poor man, he's typically migrated for work. Clearly, we have to hold men accountable for individual actions, but the way that we describe this ladens it with an idea that he's failed, he's been a moral failure to his family, to his child, instead of saying he's a poor man who needs the kind of assistance and social protection that we've been building for women. So, I think some of the good practices means, one, let's change our language. In the US, we've said, let's stop thinking about them as deadbeat dads and talk about them as dead broke dads. And understanding that, income and income support is so urgent. So how do we build programming that looks at, social protection, cash support, that looks at him as a subject in need of support from a state that should be doing its care? And I think that then shifts the language to his moral failure. And then we can sort of silence the stupid dads' rights groups as well, who don't acknowledge what, their class and privilege. And some of them have good reason to question. But I think if we do the hands-on care, if we support low-income households, including low-income men, and we bring the class aspect that must be part of the analysis around this, then we understand how poverty and structural disadvantage is what so often drives whether men are present or participating in the household.
No, and thanks, Gary. And just to back that up with the South African statistics, that graph that I showed about co-residents being highest in the higher income quintile, that was true across racial groupings. So it was really interesting to, so if you look at the highest number of non-resident fathers, it's very much Black fathers who are mostly non-resident. And that's been very clearly tied to the history of apartheid and migrant labor. But it's, the mistake that's often made is that that's racialized, that it's seen as, well, that's a function of culture. Whereas what's really clear is if you look at the income, it's actually more a function of income, as you say, because if you look at the differences between the racialized groups that we document data about in South Africa, so-called Indian families, so-called white families, so-called Black families actually have, an insignificant difference. It's all around 74-75% of co-residents. So as much as co-residence is a proxy for care, that's really encouraging. And it's as you say. So we have about 5 minutes left. And I can see that some participants have to leave. We've got about 17 left. Can I open it up? And, anyone this is a meeting format, it's not a webinar format. So if I can ask the participants, if you'd like to, you can put your hand up. Otherwise, you can just go ahead and please ask a question or make a comment. But I'd like to hear a few other voices of those who were on the call with us. Maybe I can ask that we raise the hand, and if you can raise your hand, then I will give the microphone to you. I've seen a few colleagues who've been quite active on the chat. So, Nikki, is there something that you wanted to contribute in a minute or two?
Hi, Vessel. So there's so much to say. I'm not sure I'm in a minute or two, but really interesting discussion. So thank you all very much. And I think those questions were really important, partly in showing the complexity of this issue, and the assumptions that we make sometimes about when you're talking about men caring. It seems like a simple thing, but actually it's very complex, and it's related to the relationships within the household, within the community, and the way other people view men as well. And I think the point has been made, but we were talking about it in the chat, that just the importance of starting really young, because these things are kind of entrenched so early. But with both girls and boys, I think there've been a lot of campaigns in the UK against the kind of pinkification of toys, for example, that, you know, girls have to have dolls and wear pink things and boys have to wear kind of, you know, have blue. And I think that's actually got worse in the last 20 years. It's been commercialized. So, you know, we need to look at that on so many different levels. I remember going to a nursery in El Salvador where they were trying to break gender stereotypes. It was a project run by Plan International. And they had the boys doing the cooking and the girls playing with the fire trucks. And it was great, actually. But they also then had to work with the families, because the families were saying, well, why are you getting my boy to do the cooking? And why are you getting my girl to play with the fire engine? So it just shows, you know, we need to work at this in so many different levels. Yeah, I'll stop because there are other people who want to talk. Thank you. But thanks very much.
No, that's very valuable. Thanks, Nikki. Moses, please go ahead.
Hello, everyone. Thank you very much. Yes, I think working with boys from a very early stage can actually help us to be able to change the mindset of people, even to accept that care work can also be done by men and boys, even at a community level. So I think there's need for a lot of sensitization, a lot of families, first family doing care work, then they also share with the next one, then third, fourth, fifth, up until the whole community understands how care work is really important and also can be done by men as well as other members of the family. Thank you.
Colleagues, we've got about 2 minutes left, so I'd like to pass it back to our panelists. Just for a one-sentence conclusion on the topic of an ethic of care and taking care of. And then I'd like to encourage everybody to please look out for the third installment, which is going to be about giving care and the care work that's involved. And we will advertise the date on the MenEngage platforms. But let me pass to our panelists just for a closing comment on what we've spoken about. I'll just follow as I see you on my screen. So Asanda, please go ahead.
I think sort of my final thoughts really is to, first of all, agree that data always helps, research always helps. And so part of the work is to make sure that we continue to speak to people and we continue to do the research, but also that I'm encouraged that some of these conversations are happening and they're happening at a cross section and across the continent and not just even in South Africa and globally, because I think it's when we engage and we share our experiences and we question and we challenge and we probe each other that we're able to begin the process of breaking down the stereotypes and the process of really dismantling patriarchy at its root. Thank you.
Thanks so much, Asanda. Gary?
Yeah, I agree with all of that, Asanda. I would add, you know, I think we've seen COVID has made clear that men can do more care. They can be nudged, pushed, engaged to do more care. And I think the question becomes, how do we not just make this an individual issue of individual men's failings or actions, as much as we do need individual men doing this, but to say, what are those circumstances that drive it in the long term, in the workplace, in parental leave policies and social protection policies, in how we raise boys and girls from the earliest ages and building it into early childhood development programming. How can we think about those kinds of structures and supports and systems that have to change, that the changes we're seeing in this moment of crisis can become long-term and meaningful and deliberate? And thanks again, Vessel, for pulling us together for this.
Thanks, Gary. Thanks for joining. And Mbuyiselo, over to you for the last one.
Well, thank you, Vessel, once again for putting this together. But I am of the view that these discussions, these conversations, uncomfortable as they are, unconventional as they are, we need to continue to have them. And the work that, that Sonke Gender Justice has done, that some of us are carrying into different spaces, like the Commission for Gender Equality, I think that they're important. I think that we must continue. But like I said earlier, it's not easy when a Vessel and colleagues to talk about, or to make men to reflect on them being beneficiaries of patriarchy and saying that we must in fact challenge these unending benefits. So I just want to say that I find these discussions quite valuable at a personal level, political level, and generally as a man. In that, I mean, since we started this, it has made me to go back to certain things that I had taken for granted, that I was forced to think deeply about care work, about people that had cared for me, that people I care for, that, you know, so I thought we should continue to do this. Once again, thanks to you and to MenCare and your team.
Thanks so much, Mbiselo. Thanks, everybody. We're slightly over time, so I'm going to put a pin in it and close it over there and say, keep on taking care of yourself and keep on taking care of others. Thank you. Bye-bye.